Hi, my name is Michelle Abadin, and today I'm going to talk about stress, mindfulness, and guide you through a short mindfulness technique. So, stress is something everyone experiences, but when it becomes chronic, it can really affect the body. When we say stress for a long period of time, our body's central stress response system, or the HPA axis, stays activated, and cortisol, our stress hormone, stays elevated. Over time, that can lead to decreased immunity, high blood pressure, inflammation, trouble sleeping, headaches, anxiety, depression, and even stomach issues. Chronic stress can even change the brain. It can shrink the hippocampus, and which affects memory and learning. So, as you can see, chronic stress truly impacts every system of the body, which is why learning stress management is so important. So, what is mindfulness, you may ask? According to the American Psychological Association, mindfulness is the awareness of one's internal states and surroundings. I've always seen it as being present in the moment, which leads to being purposeful and intentional with reactions and actions in our everyday life. Moving on to how mindfulness impacts our physical and mental state. Mindfulness has a real impact on both mental and physical health. It activates the parasympathetic nervous system, which helps lower heart rate and blood pressure, decreases cortisol, improves sleep, and calms the body. It also helps with emotional regulation and focus. To support the impact that mindfulness can have on health, especially during serious illness, I used a peer-reviewed article by Wardani in 2017 that studied mindfulness meditation in cancer patients. In this study, 32 cancer patients participated in mindfulness meditation twice a week for 4 weeks. Each session lasted about 45 minutes, and the researchers measured both stress and coping mechanisms before and after the intervention. The results were very clear. For adaptive coping, the average score before mindfulness meditation was 2.36, and after 4 weeks of mindfulness practice, that score increased to 2.58. This shows that patients were using healthier, more effective coping strategies after learning mindfulness. For maladaptive coping, the average scores before the intervention was 3.28, and after mindfulness intervention, it decreased to 2.96. This means that patients were relying less on negative or unhelpful coping behaviors like avoidance or denial. Overall, the article explains that mindfulness helped cancer patients focus on themselves, manage their emotions, and stay grounded in the present moment. As a result, they were better able to cope with the physical and psychological stress of cancer. This study really shows that mindfulness isn't just a relaxation technique, but it can actually improve how patients deal with stress, even in the midst of something as overwhelming as cancer. Now moving into my mindfulness technique. For my demonstration, I'll guide you through the 5 senses exercise. This technique comes from positivepsychology.com, and it's a really quick way to ground yourself by using our very own 5 senses. So let's begin. Oh, and just to remind you, our 5 senses are sight, touch, hearing, smell, and taste. So let's begin. We'll start with sight. So first, we'll look around and find 5 things that we can see. And we'll do it in our head. And then we'll go into noticing 4 things that we can feel, which would be like my shirt, my curls, glasses, things like that. And then we'll move into 3 things that we can hear. So I can hear the cars driving down the street, I can hear rustling behind me, and I just heard a bird. The 4th thing we would go into is smell. So we can identify 2 things that we smell. I can smell my shampoo, and I can smell my perfume, which is kind of hard because I'm sick. But I did smell those 2 things. They're very close to me. And lastly, you'd find something that you can taste. I just brushed my teeth like 30 minutes ago, so I can't really taste anything, and I haven't eaten anything. So I learned that this exercise brings me right back to my body. It brings me back into the present moment, and it makes me experience things that I don't usually experience. Like, I usually don't sit down and say, like, oh, what can I smell right now, or what can I hear, or what can I see? Like, I usually just fly through the day, and I'm like, oh my gosh, I didn't even see that. Or like, my dad will say, like, you didn't see, like, I left you this in the front door, and I'll say, no, I just walked right past it. So I feel like this exercise really helps you get back into the moment. So with my reflection on how I felt trying this technique, at first I found it a bit hard because I did feel myself being a little impatient and wonder like what I was doing after the exercise. But the more I circled back to the importance of it, and I was able to redirect my thinking and attention back to the exercise, I noticed that every time I finished, I felt calmer, more grounded, my breathing slowed, and I felt just more present overall. It definitely helped me reduce my stress levels at the time, and I can see myself doing this before exams, during busy shifts, and anytime I feel overwhelmed. I'm definitely going to be using this as a coping mechanism. Thank you for watching, and stay mindful.